All right, so this is Harry Campbell from Biofeedback Resources here in New York. And on the other side, we have Dr. Jorge Palacios in Mexico City. And so we're going to talk a little bit today about traumatic brain injury. The first thing I wanted to just ask you is how big of a problem is traumatic brain injury?
Well, thank you. Well, first of all, Harry, thank you very much for this interview. Let me tell you that this is a big problem, not only in the US, not only in America, but all over the world. There are, for example, about 52,000 deaths per year related to TBI. And there's a great incidence and prevalence, for example, among children between 0 and 14 years old. Um, in the cases of the severe TBI, there's a 33% of mortality rate. There's, for example, 17% of mortality rate outside hospitals, and more or less the 6% of mortality rate in hospitalized um, patients. So, as you can imagine, this is those are big numbers. This
Yeah,
is an important problem.
definitely. And what would you say are some of the most common symptoms of when someone has a TBI?
Well, after the insult to the brain, as many neurologists used to say, the person that has TBI can feel a certain time of drowsiness. There is an important. This is an important symptom. It is also common to have speech disabilities in the moment, to feel disoriented, an important headache. As long as it is a more severe damage, there could be problems in the motor skills, in the motor coordination in general. The disorientation could be more important. And after the TBI, if it is not attended in the moment, if the person just let it go with paying not too much attention, I'm feeling that this kind of problems are just for the moment. The symptoms could be worse. For example, the loss of memory problems, important ones. There also could be important problems like the consciousness, the loss of consciousness for small periods of times, attention problems. The headaches will continue to grow up and become more severe. Irritability in general. The patient can be seen with more irritability from each day. Every day, this kind of behavior and emotional problem is going to be growing. And of course, the problems related to the sleep disorders will become more severe. So you can have the person with drowsiness during the day and sleep disorders during the night.
Wow.
So this is a big change in the life.
Right, and you mentioned about the irritability and also sleep problems. So I can imagine that that would, in many cases, lead to relationship problems.
Yes, relationship and all type of relationship with the family, in the workplace, and in general in the social. The people that suffers from TBI consequences have important problems in the social field. They
Right.
cannot have good relations, no matter that they are circumstantial. For example, going to the shopping just to buy something in the store, and they will feel different kind of sensations that do not tolerate the social interaction.
Mm,
They can feel aggression from a place, a situation that there aren't any aggressions. But this type of irritability also leads to an impulsive behavior.
mm-hmm.
So sometimes they are not only with irritability, but also with aggression. And this type of aggression and irritability are just like a burst. You
Right.
can see these persons with almost a certain type of normal behavior, and suddenly, just from nowhere and nothing, became aggressive or just intolerant.
Right. Now I see behind you there's some images there, and that kind of leads me into my next question. How are the effects of traumatic brain injury um, able to be recognized through using EEG or brainwave technology?
Well, brainwave technology is a great help, and have an important role, play an important role uh, assessing TBI and the consequences of TBI and the consequences of multiple TBIs. The organization of the brainwaves is pretty peculiar in the case of TBI. The whole brainwave activity changes in a small amount of, or in a great amount of the organization after the TBI. There are the so-called neurophysiological markers. This means that there are certain type of organization in the brainwave that it is characteristic to the TBI. The most important is related to the presence of the very slow waves, delta waves, that are present in an important amount of voltage and are in more amount in all the brain than the other brain waves. For example, beta waves or alpha waves with the eyes closed. So the brain changes the whole activity, and suddenly, no matter that the person is awake, no matter that it is during the day, there's an important presence of delta waves. That explains part of the memory problems, motor coordination problems, also the irritability. And there's an important problem related to consciousness, because you can find this type of slow waves of high voltage in the frontal lobes. Also, the disorientation problems are related to this kind of new organization of the brain waves after the TBI. And this is pretty specific in the case of TBI. The other problem that you find when a person suffers from the TBI consequences is that the synchrony and the coherence in the QEEG recording is lost. Some parts of the brain is working with different type of brain waves than in the homologous part, for example, frontal lobes. It is common to see that in one frontal lobe there's an important amount of slow waves, and in the other there are more fast waves, for example, beta. And in one moment, you can see bursts of very fast waves with high amplitude, which is related to the irritability in the cerebral cortex. So it seems that the whole brain activity is with a new, different type of organization after TBI. And this type of organization is related to the symptoms that it can be observed in the patient.
Wow. Well, so it seems like we can get a lot of information from the looking at the EEG signals.
Yes, there's a lot of information and precise one.
Hmm.
And precise one, because if you compare this type of organization with the one that comes from the normal people that doesn't have suffer from TBI, well, it is very different. It is pretty different, the activity in these cases. And also, this new activity can persist all over the time.
Hmm.
So this will explain the cognitive disabilities, and also it can explain the memory loss of the patients that cannot reorganize the brain activity because the lesion has been great or severe.
Hmm. Okay, and the next question I had was, um, as far as causes of traumatic brain injury, what would you say are some of the more common causes of traumatic brain injury?
Well, the most common are the motor vehicle accidents. All type of motor vehicle, but of course cars and trucks accidents are the more important ones, and also the work related, for example, in construction and in the army. And there are important cases of TBI um, consequences related to work, and one of the most important causes is related to the sports. So, as we can see, there are different causes in the different types of life we are living all the time. Because if it is not in the transporting, then it is in the sports or in the work. But there are different sources for TBI. There's a special risk factor in the elderly, people 75 or more, that is related to the falls. In these cases, the person sometimes living alone with no help near, have falls, and they get important injuries to the head. And this related to the age will result in important sequela to the injury of the head.
Hmm. And a little bit more about the sports. I know, for instance, there's been a lot of news recently in the National Football League
Well,
here in the United States.
well, in the National Football League and internationally, the most recent is not related to the football, but it is related to the ski.
Mm.
You see this important, well, this is just as curious, and this is very interesting, this news. You know, the important pilot from the Formula One, this Michael Schumacher, that
Hmm.
won a lot of world championships in Formula One racing. Well, he got injured skiing
Mm.
this past Sunday.
Oh.
He fell and went to a big rock
Mm.
and got hit in the head.
Mm.
He's now in a medically induced coma, and with a slightly improvement in his health, but he got a big injury. So what he did not get in the cars running at many kilometers an hour, he got skiing.
Mm.
And it was just one accident, one TBI that was needed to have these big consequences because it cannot be predicted how it's going to be overcome. And this was just recently.
Mhm.
And of course, football, also hockey,
Mhm.
deserve a special comment because there is not only one TBI, there are multiple TBIs that these players are suffering during the different kind of seasons where they are playing and all over the career.
Mhm.
Um, And it is also important to be mentioned that sometimes, in the cases of the amateur, for the players that are working in the scholar leagues,
Mhm.
they are more exposed to the lesions
Right.
in the football, and also with the children, with the kids that are playing and are beginning to be trained in football. They have a lot of lesions. There is a specific consequence, for example, in the case of professional players, football players, with important consequences, very important depression that some of them have committed suicide,
Right.
motor disabilities, cognitive disabilities,
Mhm.
and there are another neurodegenerative illness that are associated to multiple traumatic brain injury.
Right.
Like, for example, Alzheimer's,
Mhm.
Parkinson also is related to these cases. Of course, these are premorbid conditions,
Mhm.
but they are accelerated or are presented more easily due to the multiple TBI history.
Right. Okay. Well, that's very helpful, very interesting. And I want to continue the conversation with you in another segment, but before we stop, I just wanted to just ask you to give just a little bit about your background.
Well, my background. Well, I'm going to try not to bore all the audience, but well, I was trained in psychology, and I also was trained in psychophysiology, psychobiology in the master degree in psychobiology, the PhD in neurosciences, and I also have the specialty in applied neurophysiology and applied psychophysiology. And I worked since some years ago in applied neurophysiology, working with special cases like, for example, TBI and also PTSD and addictions that are pretty related. Many people can think, where are them? Those are different fields completely, but no, they are pretty common. You can find cases that are very related from addictions, TBI, and PTSD. I have been working with biofeedback and with neurofeedback after doing many years basic research in experimental neurophysiology and experimental um, neurophysiology and neurology related to brain lesions. All that kind of work was in the lab. But after doing that kind of work in the lab, I decided to work more with humans. So I started working about 15, 20 years ago with neurofeedback and biofeedback. And since about 10 years ago, more or less, I started working with brain mapping and with neurofeedback related to TBI and PTSD.
Right. And you have a clinic in Mexico City area?
Yes, I have a clinic in Mexico City, and I am also trying to start my work in Florida, in Miami.
Yes.
So that's more or less a synthesis of my work and my areas of expertise.
Okay, well that's good. What I'll do is we're going to just put your post your website at the end of the video, and I'll put mine in there too. But what's your website?
Well, it is www.biofeedbackcentermr.com.
Okay. All right.
And well, you can find me there also.
All right. And my website is www.biofeedbackinternational.com. And we, of course, are also working on some webinars and seminars to cover some of the areas that we're talking about, including traumatic brain injury, which we'll go into more detail. I have more questions for you, but
Oh,
we we're out of time for now. But we'll continue in our next conversation and cover the rest of the questions. And maybe after we finish talking about TBI, we'll talk about some other areas like chronic pain and things like that.
well, I will be delighted and to have more interviews like this one.
Okay, sounds good.
Okay.
All right, thank you.
Yeah. Yeah. Thank you.